Greetings, welcome to another conversation for the Miami Corona Project. Today I am thrilled to bring former Miami-Dade County Mayor Alex Penelas to speak with us and share his thoughts on the Miami Corona Project. Alex Penelas began his public service career back in 1987, just 2 years after graduating from the University of Miami School of Law, serving on the City Council of Hialeah. In 1990, Penelas became the youngest person ever elected to the Miami-Dade Board of County Commissioners, where he led the charge to create the Commission on Ethics and Public Trust. 6 years later, he ran and was elected as Miami-Dade's first executive mayor for 2 terms, from 1996 to 2004. During his 10 years of public servant, he led initiatives for funding the expansion of public transit, establishing universal pre-K, designing gun control legislation, reducing property taxes for seniors, creating the homeless trust, and more. After 15 years out of public office, Penelas is now running for Miami-Dade's mayoral seat for a second time. Alex Penelas is the son of 2 Cuban immigrants and has been married to Lillian for 25 years. Together, they have 3 children, William, Christopher, and Alexander Maria. They all live in Miami-Dade County's Miami Lakes. It is my pleasure to welcome Alex Penelas. Hey, good to see you, Mayor Penelas.
How are you? Good to see you. How's everything?
Well, we're doing good. I'm here at home. I have a mockingbird chirping outside my window, so he may be interrupting our conversation. But Carlos and I are doing okay, and we're sort of coping and dealing with this incredible pandemic. But it's always wonderful to see you and to hear you. We've been friends for a very long time, so it's wonderful.
Likewise. Thank you for having me, and I look forward, hopefully, to make some sort of a meaningful contribution today.
Thank you so much. First of all, just at the personal level, we're going to talk about your role as a public servant and, of course, your aspirations in leading our county. But just as Alex, how has this pandemic impacted you personally and your family and your kids? How has this global pandemic impacted your household and you?
Well, actually, we've been very fortunate, Xavier, because health-wise, we have been healthy. We have not, no one in our immediate family, and certainly no one, Lily or myself or the kids, no one's gotten ill. In fact, both Lily and I have been tested for the antibodies, and we tested negative. So in that regard, we're very fortunate, and also, no one's lost a job, no one's lost income. Although I'm in the rental business, and there's been some concern there, and there's still room for more concern. I see the economic issues almost secondary to our health, and we're very fortunate that we're all very, very healthy. So in terms of, not necessarily in the order of impact, but for us, I think the homeschooling was an immediate shock, because remember, we have the older boys, and then we have a second grader at home. Lily and I started all over again. By the way, now it's 26 years of marriage. You must have read an older version.
Congrats. Well, you beat me by 1.5, so congrats. That's awesome. Yeah, I remember. We've known each other that long. But yeah, 26.
So from that perspective, it was challenging, because a second grader still needs a lot of assistance. But, thankfully, for the most part, Lily, for the most part, and myself, to some extent, we were home and helping her. So that was of concern. The second area of concern was with the older boys, because early on, if you recall, there was kind of like this nonchalant attitude, especially from millennials, who felt like, all this data was coming out that the virus really only impacted people over 65 or with underlying conditions. So, we had the challenges of reining in the boys a little bit. My number 2, as you know, goes to the University of Miami to law school, and he lives across the street from campus. So making sure that, he was staying home and safe once the stay-at-home orders were issued. And with the number 1, my older son with a girlfriend in Kendall, and the back and forth, that was certainly a concern. So as time passed, really then our concerns became more from the business perspective, because like I said before, we are in the rental business, and there was a lot of concern surrounding that. But again, I don't, we were blessed. I will take whatever inconveniences we had any day, because I know that there were so many more families that suffered so much more than we did, including having lost loved ones.
Yeah, yeah. In fact, just this morning before signing on with you, I went to the health department site, and these are today's statistics. I'm sure you can read them to me just as easily because I know you're on top of this. 550 new cases of COVID-19 tested just yesterday. That brings our total of residents to 23,904 who've tested positive. We have 3,642 hospitalizations, and painfully, 864 families abruptly lost someone without even being able to say goodbye in most cases.
Right.
So we are there, and I've seen your social media and how much you're trying to help and give advice and provide resources to the community. So I thank you for that. Reflect a little bit on how this pandemic impacted this county. Were we prepared? What recommendations do you have to improve the situation coming forward? New York Times, mentioned, Florida is, one of the top 3 states with new infections. We've weakened a little social, distancing a little bit. Looks like it's on an upswing. We're nowhere near out of this. So just reflect a little bit on how you feel the pandemic has impacted our county, and what recommendations would you have? And you can answer in 2 ways, just presently, but also what would the first day of a Penelas mayorship, right? Coming back to lead us as mayor in November. What does the first day look like for you? We don't know what's going to happen with the pandemic. Those numbers I just read you are going to be dramatically higher. We don't know what's going to happen with businesses. We don't know what CARES is going to do to fund our county budget. So I'm just going to let you just speak broadly about your perspective on where we are, how prepared we were for it, how we responded, what we can do between now and November, and then what you would do come November to lead us, because we're far from over in our economic recovery, in our preparation for future pandemics, and clearly in addressing the pandemic, the hospitalizations starting November when you, if you're elected mayor.
Sure. So at least 3 different areas to your question. Were we prepared? I don't think.
Right.
I don't think any community in the country was really prepared, and it started at the top all the way down to the bottom. And even though we've managed many crises here, as mayor, I managed.
I remember
storms, Gianni Versace, Fine Air, the aftermath of 9/11. But this was a different type of situation. There's basics you get from those other crises, but this was different. And we were not totally prepared. We ended up having to redefine who an essential employee was. That's an important lesson, because unfortunately, really the least vulnerable were the ones of us that were able to work from home. And it was, we adjusted and we moved on. The most vulnerable, minority communities especially, were the ones that became the frontline workers in our response to this pandemic. And yet we sent them out to this new battlefield, quote unquote, without the proper equipment, without the PPEs, without the masks, without the gloves. We didn't sanitize our buses. We didn't have enough public transportation. I mean, we learned a lot as to who is really a essential employee. And it also, I think, exposed some of the weaknesses we have overall in our economic makeup when you have these, obviously we're blessed to have a strong tourism and hospitality industry, but that's the industry that's most impacted by this type of crisis, with folks who are at the lower end of the wage scale and therefore have the least amount of resources to respond. So, we were not totally prepared, and we learned a lot from this. And, the one thing I would do differently, and I mentioned this on day one, is that, and again, it's not a criticism, Xavier, it's really based on my experience of having been mayor and having been the crisis manager on so many different occasions, is when there's a crisis like this, we need to have one person speaking on behalf of the community, one clear messenger, with one clear message. That message needs to be based on advice that you're getting from experts, right? I was never an expert on hurricanes, but I would have the right people sitting next to me giving me advice. But when we decided to move forward on let's say an evacuation order or whatever it was, I'd pick up the phone. I'd call the mayor of Miami Beach. I'd call the mayor of the city of Miami. We would coordinate messages before it was announced to the public. So when the announcement was made, it was very clear and everybody was on board. And I think we had a lot of conflicting messaging, both in the ramp up and it's happening again now in the ramp down of this crisis, where you had, for example, the mayor of the county saying, no large scale events need to be canceled, only to have the city mayor, the city of Miami mayor, rightfully so, by the way, canceling Ultra and Cayo Ocho the next day. Well, that there's a lot of conflict there. So what would I do on day one? I'd make sure I have the experts sitting next to me. I would base my decisions on the scientific data that's being provided to me. I would make sure that I've reached out to my municipal partners, and I would issue orders and recommendations that are comforting, but they're firm and they're consistent. We can't have then, 6, 7, 8 other mayors from around town who have every right in the world to speak. But the reason they're speaking on their own is because there was no coordination with the county. That's why they were doing it. And there were political rivalries between the county mayor and some of these municipal mayors. So that's something I would change on day one for sure.
We've seen that at the local and clearly at the national level, right? The bringing partisan politics or just plain old local politics into decision making, into policy making. The act of wearing a mask in some parts of this country is an act of courage or political dissent. And I just wonder, in our community, which has seen its polarization in the past, how you would help address that, how you would help address that divide among people who act on public health issues based on ideology as opposed to on science data. How could you, as an experienced public servant, navigate that clearly political and partisan divide?
Well, I think my experience and track record will help in that regard, because I think the public will always remember me as not being someone from an ideological extreme. I was always a consensus builder. If you recall, a lot of the very, very progressive things I got done as mayor, things like the homeless trust, universal pre-kindergarten for 4-year-olds, the transit initiative, the ethics commission, so many other things I did, I was able to go downstairs to a very, very conservative and Republican county commission and get those things passed. And yet there were very progressive issues. So no one's really, although I've been a lifelong Democrat, no one really has seen me as an ideological extreme, that I will call things the way I see them. And I'm okay with working with a Republican colleague from the city of Miami, just like I was okay working with Jeb Bush when he was the governor and I was the mayor. And I was okay working with Marco Rubio, who was ascending in the House at the time when I was mayor. And we got a lot of things done. So I think that experience works. I'm not a conflictive person by nature, quite to the contrary. I think I'm very much someone who tries to create consensus. I listen. I'm always open to listen. But when I make a decision, I say, okay, this is the decision. I use the bully pulpit and I move it forward. So I think that style of governance is exactly what you need. I think there's a difference when you are of that nature, when you make a recommendation that people will abide by it. And it's interesting is now that I'm back on the campaign trail, so many people tell me that, oh, we remember you when you were handling hurricanes, and we were waiting, we were glued to the TV to wait to see what you would say, and whatever you said, that's what we did. Well, that's what a leader's supposed to do. That's what a leader's supposed to do, is to inspire confidence in the public and to lead, because the public wants to know that those recommendations are based on science, on data, not on politics.
So this particular pandemic obviously is happening at the same time that our nation is distraught with the racial injustices, the systemic racism that has happened. And of course, just as this pandemic has shown our vulnerabilities, people who have to get on that bus, who have to go work because they don't have another way of making a living and they have to feed those families. The pandemic is happening at the same time that our nation is clamoring and asking for us to end the systemic racism. And I'm just wondering, from your perspective, if you can see some connections between those two. And let me throw a third one in there too, which of course is our climate crisis. We know that this is not our last pandemic. It's not our first, but it definitely isn't our last. We're going to, because of climate change, as you know, we are literally deforesting. By deforesting, we stop the sequestration of carbon, which means less oxygen, more greenhouse gases in the atmosphere, more importantly. And that matters for a disease like this, which of course has particles in the atmosphere. That pollution is a problem for a disease that at its core is about respiratory issues. So moving forward, if we continue, sort of polluting, our Paris talk numbers, the amount of greenhouse gases we put into the atmosphere is even larger. That causes ecosystem collapse, and deforestation brings wild animals that would have never come in contact with humans, either at a market where you have wild animals from different forests, or with humans. It only in a very globalized world with more deforestation, more greenhouse gases, exacerbates the issue and makes pandemics more fatal, more contagious, and coming to our shores. So there's this I think consensus that we're looking at, that this is not just a climate issue. This is not just addressing the issues of racial inequity. It's not just talking about public health, but I think it's a new way of thinking. So in a more universal way, this pandemic, this moment that has made us all pause, stop the economy, have us listen to science a little bit more, even though we're still divided among partisan lines. It has exposed some vulnerabilities on how we as a society, and I'm not just talking Miami-Dade County, I'm talking globally here, we as a society operate. And I just wonder if there's some lessons that you have learned looking at these three disparate but interrelated things that help us reshape the way we order and organize our society. And I know it's a lot to ask for a mayor in one of our cities, but in so many ways, I know Miami to be the America of the future. I know Miami to be the demographic of the future. I also know Miami to be this international gateway. So I see Miami as a site where experiments happen. And you as the person aspiring to lead us, but it's really leading the future of our hemisphere in many ways because of our role as this central global city. I'm wondering how you would, in your local governance, try to model what it is that future cities should be doing across all of these divides that I just discussed.
Well, again, several portions to your question. I think the first part of the question, had to do with how the conversation surrounding race that we're having right now was impacted by COVID, and I think it was because it exposed some of the other issues surrounding systemic racism. Why is it that if you are African American, you are not as healthy, for example, and suffer from certain health issues? Why is it that there were a greater number of minorities, including African Americans, who were put out to the front lines as new essential workers, right? And they became now the folks that, in spite of other issues, had to go out and respond. I think it exposed economic inequalities because people who were unable to pay their housing costs or didn't have adequate transportation were impacted by the fact that they couldn't make rent payments or the public transportation systems were shut down. So it did expose, it's interesting because the pandemic on one hand provided us all these interesting opportunities to kind of relook at the future. And I'm going to get to that in a moment, but it really highlighted a lot of the inequities that already existed before the pandemic. But moving forward, and for example, even on testing, we knew that, certain segments of the population had easier access to testing early on during this crisis than others. Those are all issues that I think we need to look at it. Unfortunately, it took the unnecessary murder of George Floyd to put a spotlight on all of this. But these problems existed before. George Floyd was not the first, and police brutality is not the only issue. There's many others. So now you're saying, how do you take all of that and you look, into the future? Because I think there are opportunities. My only concern, though, Xavier, is that let's not be so concerned about what the future holds that it serves as another distraction. You know, we have some fundamental issues here in a place like Miami-Dade County that we need to address. And it's not just inequality, it's transportation, it's sea rise and climate change. These are real issues. And we can't use the pandemic as an excuse for more and different studies. I'm going to give you one example that concerns me because, you know, I took a particular strong position on expanding our transportation systems in Miami-Dade County. And unfortunately, we've seen very, very little progress over the last 15 years, even though when I left the mayor's office, I left a 30, 40-year plan with a funding source to address many of those issues. And it's been one distraction over another. First, it was, well, Uber and Lyft is going to solve the problem. And then we're going to modify our taxi system. And then we've got scooters and there were trolleys and we've got autonomous vehicles, all these, and let's study this, let's study that. And as a result, we've made no measurable improvement on transportation in this county. The last extension of Metro Rail was approved under my administration. So I say this, is this going to be another distraction? And my response is, even if 20% of us start working regularly from home in the coming weeks, years, decades, we're still going to have a traffic mess on our hands. So we got, there's some basic fundamental issues. Okay, providing healthcare to minority communities, dealing with educational inequality, with wage inequality, diversifying our economy. There's some basic issues that's what I see as the future. And as the ultimate optimist as I am, I see all the planets aligning. That's where I see the pandemic, hope no one takes this the wrong way, actually is providing the springboard to address a lot of these issues, because I think there's going to be a willingness from state and federal governments to provide more resources, to build out infrastructures, to deal with the affordable housing issues that we have, to invest in healthcare and in greater testing, to support our new essential workers. So I think there's almost a perfect alignment of the planets here to address a lot of these issues. And that will help also with the economic recovery, which was the third part of your question, because we do need to stimulate the economy. And I think by providing these type of recovery projects, we can do that as well. So I look at all this together, and I think we could all actually make it all work. All these things I think can work for the better.
Yeah, the question was really about how to reframe issues like the pandemic issue. Some environmentalists are really concerned that because all eyes from the pandemic, that there's a lot of gains that have been made since the Nixon administration that are evaporating and have evaporated in Washington in the last 3.5 years. But we're also worried that the focus is now on pandemic as opposed to still addressing the issues of environmental degradation.
But again, I think they go hand in hand. I think because you need economic recovery, you need to create jobs, and we have shovel-ready jobs that are in the climate change arena. We could actually support both. We can help recover the economy and create good-paying jobs, but while addressing the issues that existed before the pandemic, including infrastructure improvements and mobility, water and sewer, and of course, climate change. So I actually think one actually can help the other.
Yeah, that's what I was trying to say about this new vision and how to make that happen in Miami, a place that is so threatened by what promises to be a stronger hurricane season this year, according to Dr. Kurtman, who was in one of our Underwater Homeowners Association meetings, and he made a presentation for our group. And at a time when clearly the planet is getting warmer, we keep on having record heat summers year after year after year, never seen before by human species. We've never been like this. So at a time when we're literally at a crisis and the precipice of catastrophe, now we have these pandemics. And through my practice, I just want people to understand the pandemic is a symptom of the crisis. It's a symptom that we need to understand and not lose sight of the interconnectedness of all these things. And clearly you get and understand that. I hope, I love your optimism. I do that. I mean, I wouldn't do what I do if I didn't believe in a better future, but I'm a little bit afraid, Mayor Penelas, I'm a little bit afraid about what these few months are going to bring to our community, because I don't think we've seen what this pandemic does yet. I hope I'm wrong. I really hope that I'm wrong, but I do think that that death number is going to increase, and we're going to have a big economic crisis in our hands because some tough decisions are going to have to be made. And I just want, as someone who has led this community before, someone who 2 years out of law school, went and began a career as a public servant, someone who knows every single aspect of this community through your leadership and service, just to give a message of hope, not for those of us necessarily who have Instacart and who can work out of this home office, but for those who really are struggling and are fearful about a loved one who may die. Or can we just have you give them a message as we end our conversation, a message of hope that we will get through this?
Absolutely, and I feel good giving the message of hope because we've always had hope, and we've dealt with many crises. One of the biggest crises I faced as a young commissioner was Hurricane Andrew, and it was devastating. And we came back stronger, more united than ever. The hurricanes, the assault on our tourism industry after 9/11, the recessions, every single time we came back stronger and more united than ever. The period where we had so many of our tourists murdered here in Miami, and we addressed the issue, high crime rate and corruption, we came back stronger and more united than ever. When the city of Miami was on the verge of bankruptcy, and we came back stronger, more united than ever. And we've done that because there's been a collective attitude of working with all communities. And that's the way I feel. I feel whenever there's a crisis, the only way we can recover is by recovering together. We all have to recover together. It can't just be a recovery that benefits one segment of the community or the other. Is it hard? Will there be difficult decisions to make? Will there be sacrifices to make? Yes, but we live in an incredibly privileged place of this earth. It is a very attractive place, but more importantly than where we live, it's the people who live here. We are all success stories. We all have different stories. We all came from different places. We all speak different languages and have had different experiences. And we've exceeded. We've succeeded and we've done well. And I think we'll do it again. So I'm very optimistic about the future. And I do look forward to it. It will be difficult. But I think the future is bright for us.
Thank you so much, Mayor Penelas. It's always wonderful talking to you.
Likewise. Thank you for having me.
Okay. Take care.
Bye-bye.